So therapies that we do here primarily are Prolotherapy, Perineural injections, PRP, and MFAT. So Prolotherapy is hypertonic dextrose that in a specific concentration creates and triggers the healing response that your body naturally has during an injury, right, without creating any new injury. So it's an irritant solution that mimics your body's injury response in order to heal tissue that maybe wasn't fully healed the first time around. We find this really useful for ligament instability, whether genetic, like in Ehlers-Danlos syndrome, or in things like ankle sprains, like where you sprained your ankle over and over again and now the ankle feels wobbly and loose. Spine pain as well. Perineural injections are perineural, meaning around the nerve. We do what's called a hydrodissection, where we are using the fluid pressure of 5% dextrose in water to separate out the nerve tissue from the surrounding fascia and actually create like a fluid cushioning around the nerve tissue that does two things. One is it increases nerve glide, so it reduces the friction and really gets the nerve moving better without as much irritation or friction. And secondly, it has a chemical effect directly on the nerve tissue that resets the pain threshold, so that in something like carpal tunnel syndrome or any other sort of nerve entrapment, ramps down the pain response that you feel from that particular nerve. And that can be done with 5% dextrose in water or platelet-rich plasma. And so PRP, or platelet-rich plasma, is the most common thing that we do here. It's a really widely applicable therapy. It is a solution made from your own blood. We draw your blood, we take out all the red blood cells, and then we take the plasma and concentrate down just the most platelet abundant portion of that. So it's from your own body. It's the platelets that are floating around in your blood as we speak, but taken in a concentrated way, so that when we inject them into specific areas, we are, again, releasing and mimicking your body's natural healing response in a very robust way without creating any new injury. So what this can do is, in tendons that haven't healed, in arthritis that is subject to wear and tear, and many other conditions, we're able to stimulate an anabolic or healing response that begins to reduce inflammation and build back up tissue, as opposed to succumb to sort of the wear and tear of time with many degenerative conditions, or in injuries actually like mend and fix the damage of a partial tear, for example, or from a tendonitis. And then last but not least, we have MFAT. So MFAT is a acronym for microfragmented adipose tissue. This is also known as adipose-derived stem cells. This is one of the two ways to get adult stem cells. So adipose tissue and bone marrow are really the only two ways to get live stem cells. The other products that are umbilical or fetal tissue products, I think we have no reason to believe that there's anything living inside of those things. I think it's a lot of good ideas and good marketing and not really a lot of substance. So with MFAT, we're taking the living cells from your own fat tissue, processing them in a minimally manipulative way, and then concentrating the cellular components, that what we're left with are adipose cells with mesenchymal stem cells, pericytes, what are called progenitor cells, growth factors, and a whole sort of three-dimensional matrix of regenerative components that with a single treatment lasts for multiple years in many cases and indefinitely in others. So with arthritis, the studies on MFAT are looking at 3 to 5 year benefits from a single treatment. With partial tears like in Achilles tendons or rotator cuff tears, we're really looking at something that goes in there over the course of 4 to 12 months at the most, heals the partial tear. The stem cells turn into sort of tendon-like tissue, and that really should be it, barring re-injury. So there's sort of a final solution there that's non-surgical and is regenerative from the cells of your own body.